Hello everybody, this is Dylan Heyman and we're going to be talking about the hypoplastic left heart syndrome. This is a very rare disease during the fetal development of a baby. But first we're going to be talking about the physiology of the heart. The physiology of the heart is basically seen as a muscular pump with veins and arteries. And what the heart does, it pumps blood throughout our body. And we have these four chambers. We have the atria and then we have ventricles. The atria are on top of our heart and the ventricles are on the bottom, the bigger part. What the heart does is sends blood to our lungs, our body, any part. And that's what kind of makes up our skin, you see the redness on my skin right there, that's blood. There's blood pumping throughout our whole body. We need this blood for survivability. But that's when the hypoplastic left heart syndrome comes in for a baby. So during the fetal development, the left aorta, the left ventricle, the left atrium, the left ventricle, and the mitral valve all just stop developing during the fetal development phase of a baby. And the signs of this, or the cause, or what the doctors see when they first pull out your baby is, first they see the paleness, they see the fast heart that the kid has. They also feel his feet. His feet are cold. We wonder why, because the feet are not getting enough blood, so they're going to be cold. And what this does is that the right atrium and the right ventricle have to send blood to the lung and the rest of your body, so it's going to be harder and harder and harder. So some parts of your body are not going to get that blood that it needs. And some prognosis of this is that we can see that in the first year, or when the baby first comes out of the womb, that we see that if it does not proceed with treatment, then that baby will die. And if in 2 to 4 years, if the kid is still living, the chances are 60% if it still has treatment. The kid still has treatment. But when you get to 10 to 15 years, there's a 40% chance that the kid will still live. But if they exceed that 40%, you will often see that the kid or the teenager will have a lot of problems, including heart problems, not exceeding in exercise, and their lungs will fail. And you always need attention to this kid as much as possible, because there is a slim chance they can have any failure at any time with the hypoplastic left heart syndrome. And there's not many treatments for this, and some treatments we can see is the Glenn procedure, the Fontan procedure, and these occur usually after the baby is born. And I hope you guys learned something a little bit about hypoplastic left heart syndrome, and I will catch you guys later.